Hello, I'm Zobair Younossi. I'm the chairman of the BD Liver and Obesity Research Program here in Nova Health System in Falls Church, Virginia. It's my pleasure to review one of the abstracts that was presented at the most recent AASLD meeting in San Diego, California. This abstract covers the topic of pruritus in patients with primary biliary cholangitis. As you know, about 75% of patients with PBC have cholestatic pruritus. And of course, very few of these patients are actually getting treatment for pruritus. And this study was basically a case-controlled study of patients with moderate to severe pruritus, about 50 patients, and no pruritus to very, very mild pruritus, about 40 patients. These are all patients with PBC who were recruited from different sort of settings. All these patients completed different questionnaires for quality of life as well as pruritus. So they had 5D itch, and they had the pruritus rating scale, as well as quality of life scores such as CLDQ-PBC, PBC-40, fatigue or FACIT-F questionnaire, EQ-5D, and also work productivity and activity index. The interesting part of the study is that when you look at patients who have moderate to severe pruritus, regardless of what questionnaire you used, their patient-reported outcome, their quality of life was actually quite impaired, more impaired than those that have no pruritus or very, very mild pruritus. Interestingly, when you look at these patients who have moderate to severe pruritus, they also had more unemployment. So they were not employed as much as those patients who have no pruritus or very, very minimal pruritus. And finally, what's actually quite intriguing is that only a quarter of these patients, only 25% of patients who have moderate to severe pruritus was actually getting any treatment for their itch. So the bottom line of this study is that patients with PBC, probably about 75% of these patients can have pruritus, and those who have moderate to severe pruritus, they can have a severe impairment of their quality of life. And not only that impacts their quality of life, but also work productivity and employment status. And unfortunately, very few of these patients are getting pruritus or itch-directed treatment. So this is an opportunity for us to focus on what drugs can be used and how to manage pruritus in patients with PBC that ultimately can improve their quality of life and other patient-reported outcomes. Thank you very much for your attention.